Okay, go.
All right, so this is the right ventricle because it's smaller.
We caught a fly in the back.
Right?
Okay.
Okay. So the right ventricle, or the right side is smaller than the left side, right?
Yeah.
So this is the right ventricle, and this is the left ventricle.
Where's the right ventricle on the other piece of heart?
This half? This
Yeah.
is the anterior half, right?
Yeah.
So the right ventricle is here.
Okay.
And the left ventricle is here.
Okay.
So it joins together
Like that.
this.
Okay, that's where our confusion was. We were having major confusion yesterday.
Right. Okay, so the heart's just like this or whatever. And, okay. So right ventricle, left ventricle, right atrium up here is where it would be. Or, you know, up here.
Yeah.
The right atrium. Inside here.
So the atrium's like really small.
Yeah, they're super small. It's like this little thing right here.
Okay.
Right atrium up here. Left atrium up here, right?
Okay.
Left atrium up here. This here. This is left side, right side. Okay. So, that being said, that means that this will be right here. Will that be the tricuspid valve?
Yes.
Right. So, right atrium, tricuspid valve.
3 valves for the right side.
3
right?
cups.
3 cups.
Coordinate tendinae, shouldn't it be there too?
Huh?
The coordinate tendinae?
Yes, these are these little white strings. The coordinate tendinae, mostly collagen, 80% and 20% elastin. These are the papillary muscles.
Ah, okay.
These things right here that extend out.
Okay.
So the papillary muscles connect to the valve via the chordae tendineae.
Okay.
So this is a bicuspid valve because it's on the left side, right?
Okay.
Okay. So now to find the veins and whatnot that come out of it. All right, so actually first let me show you the right coronary artery, which would be the artery. Do you guys have a little poker? Do you have a poker? Yeah, I call it a poker. Thank you. Okay, so the right coronary artery is the one that feeds the myocardium, right, with nutrients?
Yeah.
Okay, so right here,
Yeah.
that's the right coronary artery. The left coronary artery
Is like something called something else, right?
well, the left coronary artery actually branches into two. It's the circumflex, which goes around the back side of the heart.
Okay.
And then the interventricular artery, something like that comes around the front side of the heart.
Okay.
And you can kind of see it. It's like squished.
Yeah, I see that.
Do you see it? It's right. Do you see that?
Yeah.
That little hole right there?
Yep.
Okay. So that's the left coronary artery. Right coronary artery. Okay. So, if this is the left atrium, what comes into the left atrium?
It's oxygenated blood
From where?
from the pulmonary veins.
Right. So, there's going to be 4 pulmonary veins, 2 from each lung, that come into the right atrium.
Okay.
So, when you're looking for the pulmonary veins, it's kind of hard to see like 4 of them per se, but do you see these?
Yeah, those are the veins.
Right, these little holes right here.
Yeah.
Obviously the veins have been cut, but these holes here.
There's only one hole, huh?
Well, here's another one.
Okay.
And here's another one.
Okay.
And here's another one. So.
Oh, those are the 4 veins?
Yes.
Yeah. So those are the 4 pulmonary veins that come into the left atrium.
From the lungs.
From the lung, bringing oxygenated blood. Then they're going to go through the bicuspid or the mitral, whatever, valve. These are the chordae tendineae.
Or the anteroventricular valve. Because that's what that is.
Right, interventricular valve. That's correct.
Yeah.
These are both interventricular valves. Chordae tendineae, papillary muscles.
Out.
Left ventricle. So out of the left ventricle, they lead through the aorta.
Correct.
So the aorta is on the anterior side of the heart.
Correct.
So this is the posterior side of the heart.
Yep.
So we're not going to find it here. We're going to find it on this half.
Okay.
So this is the left ventricle, right? Here we are. So now, just so you know, the aorta is going to come up this way.
Yeah.
So we can find it by sticking our finger through here, left ventricle, and here it is.
So that's your aorta semilunar valve.
And you're going to have the aortic semilunar valve.
You don't see the valves, really. They're just little flappy
Well, like she said that they kind of look like a Mercedes-Benz symbol if you look at them.
Yeah, that's true. Yeah.
Okay.
Just a little film of skin, which is what controls the flow.
Right. Okay, so aortic semilunar valve, aorta comes up. Okay. You can also tell because on the front half or whatever, the aorta would be here.
Yeah.
So the aorta is kind of like more to this side, and
Yeah,
then
the
the pulmonary vein
trunk.
or pulmonary trunk, is right here. So the pulmonary trunk comes out of what? The right ventricle.
Yeah.
So the pulmonary trunk leaves the right ventricle. Again, like it's also on the anterior side, so we're not going to find it here. So we're going to find it here. And if you stick your finger through here, my finger's not long enough.
What are you finding?
The pulmonary trunk, because this is the right ventricle, right? This is the anterior half of the right ventricle.
Yeah, that's where my mass confusion is.
So if you take your finger, my finger's not really long enough to go all the way out.
Yeah.
But if I stick it here, you can kind of see right here.
You come from the right ventricle through the trunk.
Yeah. I don't know if you can see my finger goes all the way through there.
Yeah, gotcha. Let me get that in film. Okay.
So it is the right atrium.
The right atrium is up here.
Okay, and this
Very
is the left?
small.
This is the left atrium. And the reason why it's like this is actually on the left side when you're looking at right now is because it's actually like this. So the heart actually goes like this. Right. So this is the right side. This is the left side.
Can you open it up and point to all the chambers again while it's open? Because that way I can map my way around.
Okay.
I'm just confused about that.
Okay, so this is the posterior half of the heart. Okay, so the posterior half. So this will be the right atrium up here.
Okay.
Right atrium. Right ventricle through the tricuspid valve. This will be the left atrium up here. And then this is the left ventricle down here through the bicuspid valve. So this is the anterior half of the heart.
So now on the anterior?
It sits like this. Open it like that. Okay. So then this would actually be the left atrium in here.
Okay.
It's this little flappy thing you can kind of see.
Okay.
Left atrium, left ventricle, right atrium up here, right ventricle.
Okay.
And like I said,
the anterior side, right?
this is the anterior side.
So
what was
the
it
anterior is here is the right and here is the left. Here is the left.
Front and back.
Right. This would be the left side because it's the anterior and it's actually like this.
Yeah.
So what chamber did we miss? So we got the veins, we got the aorta, and then we got the
valve,
the pulmonary trunk that leads. Oh, the inferior vena cava, superior vena cava. We didn't
Yes.
discuss. Okay, so the inferior and superior vena cava come out of, they go into the right atrium. So that would be this one or this one right here.
Those are your superior?
Atrium. No, this is the atrium.
Okay.
So hold on, I gotta find it. I think it's actually on this one.
Well, we're only looking for the superior vena cava, right? Because doesn't it all come to the superior, or do they all come individually through different holes?
No, there's three.
Yeah.
So there's the inferior vena cava that comes straight up.
Yeah.
There's the superior vena cava that comes in from the top, and then the coronary sinus that also goes into the right
different entrances.
Right.
Okay.
So take your finger, right atrium. So all the vena cavas are on the posterior side, so it's the posterior half of the heart.
Yeah.
So right here.
Okay.
Okay.
This is the inferior vena cava right here.
Okay.
Inferior vena cava, and this is the cut portion of where the superior vena cava would be. And then if you flip it over, so now we're looking at the posterior side of the heart. Taking my finger, sticking it into the right atrium. You see this baggy area right here? That is a coronary sinus.
Okay.
So, and that's it.
Thank you.
You're welcome.
How do I stop it?